Hey guys, it's the Doc, and here's our next installment of the hashtag Ask Dr. Miguel series of posts. So this one comes in from Reddit. It's a good one. Here it is. Week after waxing back, breakout all over. Adult male, got my back waxed for the first time. Everything was done smooth for a week. Day 7, took my shirt off to get into the shower and noticed my whole back was covered in pimples. I don't have a history of pimples. My whole life, the occasional zit every few months, but never breakout. Very oily skin, but my hypothesis was that dirt was so oily it just kept flushing stuff out of my pores. I know that after waxing you're susceptible to infection, etc., but I don't think this is the right word, but normal to be fine for a whole week and then suddenly break out. Okay, so that one was a little bit hard to decipher, but it sounds like what happened was you got waxed, you got your whole back waxed, and a week later you started breaking out. Listen, your best bet is getting to see a local board certified dermatologist who can take a look at you in the flesh and let you know what's going on and give you the appropriate therapy. If you're in the New York area, you can come see the doc. If you're not, I'm sure you can find someone wonderful wherever it is that you may reside who can help you out. But it's actually not uncommon what you're describing. So it's generally like, when you get waxed, it's a pretty traumatic experience for the body, and your follicles get kind of pissed off, especially if you have like a really hairy back. And then you can have a delayed onset breakout. There's something called acne mechanica, where like trauma to the skin can cause you to break out. And it's actually a pretty common phenomenon, even after shaving in some folks. A day or two after shaving, or even 5 to 7 days like you're describing, you can get a breakout. You also, I'm not sure if this happens to you, but a lot of folks when they shave their neck, this is a very frequent area to get like irritation from shaving, which can cause breakouts. The good news is it's very, very manageable. So when you get in to see your board certified dermatologist, they can give you some topical stuff. Sometimes you need a bit of oral stuff for a couple of weeks and some topical stuff to get you back to baseline. You're gonna be fine. Just need to get into somebody who can give you the appropriate therapy to get you back to baseline. Going forward, one of the strategies that I use for my patients is I actually give them some prescription cortisone, and I have them use it immediately after getting waxed, and they do like a few applications, twice a day for a few days to basically suppress the inflammation that the trauma from waxing may cause. And that usually helps to mitigate a breakout. But again, your dermatologist can go over that specific measure with you. Also, if this is like a recurrent issue where you're getting waxed and you're always breaking out despite using cortisone, etc., laser hair removal is an excellent option for hairy backs. We do quite a bit of it in my office, and I'm sure, like I said, if there's a board certified dermatologist near wherever you live who has lasers, etc., and does laser hair removal, that might be a good option for you as well. So I hope that answers your question. Let's get it.